Medicine, vjetori, referusin e fundit, Dr. Andreas Varkaris, who is a medical oncology specialist and principal investigator at the Tumor Center for Target Therapies at Massachusetts General Hospital. He received his medical degree at National University of Athens. He completed his residency program in my favorite hospital, Deaconess Hospital. He completed his fellowship in oncology at VI. Pleasure to have you here to talk about what is new and what our research is bringing to treatment of the patients with cancer. Thank you, Professor.
Good afternoon, everyone. My name is Andreas Varkaris. I'm an oncologist at the Termiar Center for Targeted Therapies at MGH. I specialize in clinical trials, and it's a pleasure to be here. I would like to thank Albana, Irina, and the committee for the invitation. So, since I have nothing to disclose, so no financial relationship with companies, I would like to say that this is a wonderful conference that you're having here. I think this kind of meetings strengthen the bonds between the community, help each other. It's important to be a patient and know that you are not alone. It's important to be a doctor and know that you are not alone. I think through this strengthening of relationships, you will help young people in this group, especially those that they want to go to medicine. And also a lot of people that want to come from their home countries, your home country, here and study. As you notice, all of us started our education in our home countries. I started in Cyprus. And if it wasn't an organization similar to this one in Houston to fund my postdoc, probably I wouldn't be here. So thank you. Prevention is important, but I believe that the main reason of cancer is bad luck. So some of us, unfortunately, in their lifespan, will diagnose with cancer, even if we do everything. So we will get therapy for cancer, the earlier, the best. And we want to introduce to this group the option of clinical trials. So, but before we go to clinical trials, these are two patients that we see often in the clinic. The one, it's a young woman who found a lump in her breast, tumor in her mammogram. She had surgery. She's gonna do well. She's gonna meet with her oncologist to discuss about treatment options. The second one, it's a chronic smoker. It's very common in Cyprus. I guess in Albania also. He found blood in his sputum. He went to the PCP water CT, found to have a lung mass, and now he needs to meet his oncologist to see what are the options. But who decides about these options? Like, who tells the oncologist what to use and how to use it? So there are three agencies that are big and regulate everything. One is the FDA, which we've seen a lot through COVID. The other one is the American Society of Clinical Oncology. These are doctors through the US that they meet every year, and there are several committees that they discuss and find guidelines. And the other one is the American Cancer Society, not as strong as the previous two. But FDA regulates every therapy that we will take, and also every research study that is available for us. And nothing escapes from FDA. I can guarantee that. So, okay, clinical trials. What are these clinical trials? What do they mean? So, before even we treat somebody, drug development takes 3 to 5 years in a lab, in a company. They have chemists, they have biologists, they have mice, they have big animals, and Boston actually is the biggest center of the world right now in drug development. They have to prove that the drug is effective in some conditions, cells, mice, animals, and it's safe to go to humans. And then a drug will go to phase 1 trial. So phase 1 is that when we treat for first time humans, and that's where I stay. And it sounds scary because, hey, I'm gonna be the first person on the study. Well, I met my patient on Friday. She's celebrating 2 years on a trial. She was number 2 on a worldwide study. So things work for sure. So phase 2 is that mostly testing more about the efficacy of the drug and combination therapies. And phase 3, which are the most common that they will be offered in every center, in oncology center, Lehi, BI, BU, Tufts, St. Vincent, UMass, Farber, MGH, are the ones that show head-to-head comparison with standard of care option. So therapy is already approved. Can we make something better? Do you want to participate into this study? And each one has the strength and a weakness. And I think it's a personal opinion of each individual, of you and me, to decide as a patient whether I want to get on a study that is novel, gives me the most promising agent, that, you know, we treated 100 or 200 people, so we know what is happening. So we're trying to find the best combination of the best group, or get the standard of therapy plus something else. I think it has to do with personal opinion, and this is something that you will decide with your doctor. I do believe that phase 3 trials, by the time that they reach phase 3, are already old technology, just to mention that. So, all right, do they make any difference? Well, 6% of people in the US that are diagnosed with cancer get on clinical trials, so a lot. That's hundreds of thousands. In Massachusetts, that number is 20%. If you go downtown where we live, it's around 30 to 50% based on the disease group. Do they make any difference? Well, the graph on the left supposedly should show, it's a graph produced by American Society of Clinical Oncology, so I don't want to say much, but it shows that the more patients we have on clinical trials, the better it is for everyone. So the number of patients that get into clinical trials correlates with disease outcomes for everyone. So they don't benefit only those, but they benefit other ones also. So shall we put everyone on clinical trials? Hell no. Like if I have a drug that works 99% of cases, I don't want to use anything else. So I think it's an honest discussion between you and your doctor, and decide what is best for you. So I put some questions that I will ask. So why are you doing this? So how many visits? What kind of test are you going to do? Who will be in charge? You know, many times doctors pass the patient to somebody else, right? We all experience that. What are the side effects? What are the benefits? What's the cost? Does it go to the insurance? Does it go to my pocket? Does it go to the pharmaceutical? And what are my other options? I think that these are questions that we should ask every time that we go for a clinical trial. And many times I hear from my patients that they don't want to go on a clinical trial treatment. I don't want to try anything investigational. Just give me the all good stuff, and I like them. And I respect that. That's what my father would do and my mother would do. So can I participate differently? Yes. There are screening studies, prevention studies, quality of life, economic, and all these studies that you can contribute even if you don't want to be on an experimental therapy, because it remains an experimental therapy before it gets approved. So I will be fast. So in the Termier Center, and I'm not very good with drawing, as you notice, most of my patients have metastatic disease. And we try to treat them, and at the same time develop therapies for everyone in the world. So within the last 15 years, we developed 26 therapies that started in the Termier Center, finished in the Termier Center, and now are given in Cyprus. So every time that cancer develops a strength, gets a weakness also. You just need to find it and use it for therapy. So when I talk about cancer, I think that there is a car. There is a gas pedal and a brake pedal. And that cancer cell, that car, drives faster than the rest. That's why it develops a tumor. You have to find out what is pushing the gas pedal and what is braking the brake, and try to use it for your benefit to kill cancer. It's not always available, but within the last 5 years, we have been able to treat many people that we see every day in the clinic, and we celebrate year after year. Definitely other options exist also. Immunotherapy is very hot. Personally, I believe that immunotherapy will calm down at some point. We have treated many tumors with immunotherapy, but now we know that it doesn't work for every tumor. I think there is a new group of drugs that is called antibody drug conjugates that most of us will be offered within the next 10 years. And apoptosis is something else also. So it looks simple, right? A car with a gas and a brake, but actually it looks like this. So we have the patient in the center. We have a group of people treating the patient and focusing to the patient care. We have people who collect samples, analyze data from response and progression. Unfortunately, progression is a fact. Develop mouse models from our patients and trying to test in those models how it works. So we do our best, and you can contribute with the way that you can. So spreading the words is enough. Only 10% of people are offered clinical trial in their therapy. So definitely higher in Boston. We are very privileged to be here, but the numbers are still low. So just participate to a trial, like screening, diagnostics, economic, anything that works for you and fits better with your lifestyle. And third, keep doing what you do. I do believe that patient support is very important. Independently of socio-economic status, when you get sick, and you need support. You need emotional, social, and economic support. Scholarships are important. I'm here because of a scholarship, and I think if you can give scholarship to people in this room or people outside this room, that would be wonderful. And just keep supporting each other. Thank you.
Ka shumë nga këto trials që ne nuk I dim, na kontaktojnë pacientët dhe ne nuk dim ku t'i drejtojmë, sepse nuk I dim ku janë, cilat janë dhe në cilat spitale bëhen këto trial. Prandaj e ftuam doktor Andreas dhe kemi këtë bashkëpunim me të që të na hapet një derë tek spitali Massachusetts General Hospital kur ai punon, ose edhe në spitale të tjera dhe të na tregojnë ku janë këto trial që ne ti ndihmojmë pacientët tanë që na telefonojnë dhe të dim ku t'i çojmë, ku të shkojnë ata për këto trial, se ka shumë, po nuk I dim. Prandaj ky bashkëpunim me doktor Andreas është shumë I rëndësishëm. Prandaj dhe ai ishte sot këtu për të na folur dhe për të na hapur dyert dhe për të na shpjeguar dhe për të na ndihmuar njerëzit tanë ku t'i ndihmojnë, ku t'i çojmë. Kështu që thank you so much for your time and thank you for being here.
And just a last word. So this presentation didn't have my email or my number. I'm gonna have my cell phone, and I'm happy to share it with anyone who needs more information.